This afternoon, we have one item before the committee, and that is Agenda Bill 22904. This is a presentation by Whatcom County Health Department on serving the homeless population. And here to take us through is Ann Deacon.
And council member, can you just share with me how much time you're allotting to me?
We have 30 minutes today, and there would be some time for questions and answer after.
Okay.
Just
Great.
to confirm, the next committee starts at 2 o'clock.
Well, good afternoon, everyone. I did give a brief presentation to our health board last Tuesday, and I'm going to share some of those diagrams with you today. And I'm hoping someone can share the homeless housing system diagram first. My hope today is to give you an overview of the homeless housing system, how all the different initiatives and efforts are coordinated with one another. I'll talk briefly about the shelter system that we also have for people who are living unsheltered. And then I also wanted to give you just a brief snapshot of how we actually fund all these things, which is very, very complicated, but I think it's probably helpful for you to see that as well. So is there someone, I did send the documents over, who can share this? If not, if somebody could allow me to share my screen.
I'm not a host at this point. I'm wondering if Council President Stone could do that.
Yeah, and you should have the ability to screen share.
Great. I will do that right now. Is that available to everyone?
Not yet.
No.
All right, I'm going to try one more time. Here we go.
That looks good. And Ms. Deacon.
Great. So we tried to make a one-page diagram that would explain a very, very complicated system. And so this is our attempt. And there are a couple arms to our homeless housing system, but you can see that they're all connected to one another. So very briefly, and let me just say that some of the numbers here include the entire homeless housing system. So it's not only dollars that the county government places into the system, but also the city of Bellingham. And you are, as you know, a very integral partner. So coordinated entry is a best practice, which means that there is really one front door and one central point of access, for the most part, for people who are seeking housing, who are experiencing homelessness. Coordinated entry requires, as you can imagine, not only staff to help people navigate the system and connect them to the service most appropriate for them, but it also provides all the rental assistance that we funnel through the coordinated entry. Now, we do give some rental assistance directly to other programs, and I'll talk about, but this $1.3 million that you see, and this is the budget for 2021, by the way. That 1.3 million, a lot of that is rental assistance. So rental assistance goes to the Opportunity Council that houses the Whatcom Homeless Service Center. That's our coordinated entry place. And the Homeless Service Center distributes rental assistance out, working very closely with all the partners you see down below, to make sure that the people that they are serving have case management and rental assistance to help them. And in coordinated entry, you'll see that we're assuming about 2,200 people will be served in 2021, but that also does not necessarily mean these numbers that you see in other places in terms of households served are duplicative. So some people can come into coordinated house entry, get some quick services, and get rehoused without ever having to use the rest of the system. And then part of our system is rental assistance, which, as you can see, 415 households are getting rental assistance separate from some other programs. And this is just people in various scattered site apartments, households that require this assistance in order to keep them stably housed. That is distributed, like I said, through the Opportunity Council's Homeless Service Center, but lots of case management services are commingled with those dollars. And then the permanent supportive housing on the right, we have a number of programs. You've heard of them: 22 North, Francis Place, City Gate Apartments, Dorothy Place, and some others, where we actually provide intensive services above and beyond just an apartment to live in. And so you'll see 350 households are served in our various permanent supportive housing programs. These are very expensive programs, very intensive, and great for people with a number of disabling conditions. The case management umbrella, if you will, over the top is because case management touches every single part of this system. We don't just give money to a household and expect them to get housing. It's just not that easy. As you know, the vacancy rate in this area is fairly low. And so we have case managers that work with people to not only assess their needs, but then to connect them to the services and the housing that's most appropriate for their future success. And so case management funding is critical. And you'll see we put over $3 million into this, but this is what not only science tells us works, but we have also seen it work. They help people not only access housing initially, but they help them maintain that housing, especially for people who may have been homeless for a very long time and may not have the skills to be a stable tenant without that support. So another part of our housing is shelters. It is not part of the system in the sense that shelters, you don't automatically go from shelter to housing, but shelters serve as a critical point where you can initially engage with somebody, connect them to services, maybe get them stable enough where they can start to voice their dreams, their wishes for housing, and then you can begin to connect them. In shelters, we have basically a couple different kinds. We have drop-in, meaning that anyone can go. And we have 239 beds of that variety. And there's a number of different types. And then we have specialty shelters. This is really critical to know in the sense that specialty shelters are serving people where they're not going to be successful in a regular shelter that doesn't have a lot of specialized services. We have specialty shelters for families with children. We have specialty shelters for people who have serious behavioral health issues. One shelter in particular houses people coming out of institutions, whether it's a psychiatric institution or even the correctional institution that simply need the 24/7 staffing required in the specialty shelter. We also have domestic violence shelters. We have shelters for people with special needs. And so, as you can see, the amount of money there is significant in the sense that a lot of these require 24/7 staffing and significant expertise on staff to get people safe and stable. So this was the Cliff Notes version, as you can imagine. So are there questions about this before I move to the next?
Committee members. So I can't see everybody, so hold on a second here. If you have a question, just go ahead and ask it.
Okay, I'll jump in. On this graph, are the dollar amounts here expected for 2021? I'm assuming it's not up till now in 2021, correct?
This is expected for 2021. Now, what is not included here is a federal grant that we just received. The county just received about $6.8 million from the U.S. Treasury Department to put out in-rental assistance in response to the COVID pandemic emergency that is created. The concern, of course, is that the eviction moratorium will end later this spring, and a number of households that are in rental arrears may face eviction, which obviously then creates a whole bunch of people suddenly homeless, which is a horrible thing. So this is a program where we are working with the Opportunity Council to serve households up to 80% of the area median income, getting them rental assistance for up to 12 months if necessary to pay for both rental costs in arrears as well as future rent. And this will really help a lot. So that amount is not included in this.
Committee members, other questions? I'll go on to council members, Michael Lillquist and then Lisa Anderson.
Thanks, Dan, for letting me ask a question. So, Anne, one of the questions that we're trying to answer in the Homeless Strategies Workgroup Subcommittee on funding is not just what are we currently spending, but how much more would we need to spend to reach all of the clients that we know of, that we know are eligible for service, that we could serve? Do you have estimates of shortfall in capacity in any of the components of the system? And at some point, how difficult would it be to derive estimates, roughly speaking, of what it would take to expand the system to meet the identified need?
So I'm not prepared to answer that one today. And I think we could certainly look at the number of households that are currently in our housing interest pool. And we could maybe place a guess on how much assistance they would need. Obviously, one of the issues that has been a challenge for us is the available apartment units for people. So sometimes we may have the money, but we can't find a vacant apartment. So it is very complicated, and it's not just money. But we could try to come up with that estimate, knowing that it's not the full picture.
I would love that estimate, but you raised a good point. It may not just be a matter of quantity. Do you think you could now or later, or other people come with an idea of what would need to be different about this graph? Not just more, but different about this?
I think we could certainly create a different diagram that would show the unmet need, even with this information aside. Let's say we met all of our goals in 2021. We could look at the unmet need as well as the number of units it would take to house people, and then the number of units we have. I think we'd work very closely with your planning and community development program to do that work, but we could certainly do that. Again, this is just a very, very complicated system because there are so many components to it.
Okay, Councilmember Anderson.
Thank you for recognizing me. And my question kind of dovetails a little bit where Councilmember Lillquist was going. Thank you for this graph. I think it's very useful for us and for the community to have an idea of what services and where the funding goes. I was really excited to hear about the nearly $7 million that would be coming in, hopefully so far, to assist with basically rental or housing assistance when the moratorium ends. Looking at the numbers for the rental assistance, the 450 households, do you know how many of those were due to COVID specifically and to keep those individuals housed? And then also, you know, a number that based on perhaps the funding amount we had previously that were not being able to be met as far as the need. And then also that $7 million is wonderful, but I'm wondering if there's some level of outreach happening with landlords or banks to get an idea how many people may be impacted when that moratorium ends, and is that $7 million going to be enough? We hear a lot from the community that we're going to have this huge tidal wave of homelessness because of the moratorium ending. I think we've been working towards preventing that. I just would like some idea if we can get our arms around, are we going to have a gap and how big?
So we've done some initial estimates, and we assume just from the statewide average of how many renters are in arrears that perhaps we have anywhere from 3,000 to 5,000 households that might have some level of rent challenge. We believe that maybe a little over 1,000, maybe between 1,000 and 1,500 households we can serve with that $6.8 million, which leaves a huge gap. If that's what we know so far in terms of, I shouldn't say we know it, that's our guess. We, of course, don't know to what extent people, how many months of help they may need. We don't know what the average rent assistance amount might be. So we went over past experience this last year when we had different amounts. So that's kind of what we know so far, if that's helpful.
Okay, any other council members have any questions on this portion? Council President Stone.
I think Councilmember Vargas was ahead of me. I'll defer to her.
I'm sorry, I can only see about 4 people on here, but Councilmember Vargas, sorry about that.
No problem at all. I know it's challenging. Anne, thanks so much for joining us. Quick question for you. In the bubble where it says shelters, the specialty, the $1 million, was that for the base camp or was that for the tiny homes? I'm curious where the money for tiny home villages comes from.
I don't think I can answer that one with right now today. I'll have to check with my staff who worked with city staff to fill in these numbers. The base camp is in the drop-in section, not in the specialty, but I don't know about the tiny homes, if that was included in this or not. If it was, it would be in the specialty section.
Okay, go ahead, Councilmember Stone.
Thank you. Yeah, and thank you very much for being here and sharing the information. A couple of follow-up questions just about the information provided here. So these entities listed as far as shelters and partners, do you know if all of those are in Bellingham or are some of them in other jurisdictions in the county?
Throughout the county.
Throughout the county, okay. And part of it was following up on Councilmember Vargas's question about whether the tiny home villages like Unity Village and Swift Haven, if those were included in these numbers or not.
And I will find out and let you know.
Okay, because I was curious whether or not there were any other initiatives like that, sort of that model elsewhere in the county outside of Bellingham.
So let me talk more about that when I get to shelters, if I can. And let me then go to the next screen. And the next one, and this is really not for me to explain in any detail, but it's really I'm going to talk while I'm fumbling. That's not very helpful, but I want to show you how we figure out the funding for this. And this is, and I am not getting what I need, so I'll spare you my technical troubles here. The county alone has about 13 different funding sources that we combine with one another to create the programs we create. And each of those different funding sources has also its own requirements for what we can spend it on and who we can spend it on. And so we turn inside out at least 3 times, it's kind of a rule, to create programs and fund them. And then when we coordinate with the city and some of your funds to truly stand up a program, we have to turn inside out a few more times just to make it work. So there is never just funding that's available for any purpose, no matter what. It's just really a very complicated system. And so I was going to show you that graph, but I am unsuccessful in doing so right now. But that is really what, how we do our work. And it is challenging and it is successful as well, because that's the only way we have found to really put programs together. When we have auditors from the state come and look at some of our contracts where we have all these different funding sources in there, it drives them crazy. They said, we don't see this in other counties. And we said, yes, but we have programs that other counties don't because they don't do this work. So this is a shelter capacity, and can everyone see this one? So we put together for our county council and now for you, a very brief one-page diagram to try to show the work that has been done recently in getting our shelters up and running and expanded. And I just got a text from one of my staff who said the tiny home investments are not included in that specialty shelter amount. So that's over and above. So the last winter season, you'll see in the blue how many shelter beds we had for various reasons, to include not only the homeless, or I'm sorry, Lighthouse Mission, the overflow shelters we had, the motel vouchers, etc. And last winter, basically, we had a total of 382 different types of shelter bed capacity for our community. Our effort, of course, was to improve that. We worked very closely with the city, who takes the lead on most of the shelter work, and supported their efforts to expand. And so in the middle, you'll see some of the actions we took to increase that capacity. And then for this winter, we increased and have 330 shelter beds. We added some more shelter specialty beds at the YWCA for elderly women, a few extra shelter capacity for families with children. Obviously, the city was instrumental in working with Christ the King Church and the Lighthouse Mission to create overflow beds for the winter months. We increased motel vouchers significantly, both the city of Bellingham and the county. And so we now, rather than 382 beds last winter, we now have 522 beds this winter. And then again, we're starting to add tiny homes. So you'll see Swift Haven here. As you know, the city has just awarded a contract to another couple providers to set up some more of these tiny home villages, if you will, also. Last night, for instance, we had 88 shelter beds unused. So the capacity is there. I think there's a lot of discussions out on the street about what's truly available and what isn't. And I did want to take a few minutes to just address that. We have heard horrible stories about the Lighthouse Mission and their base camp, not founded. We have people that go to base camp every single day. So a lot of the concerns about there being violence upon others, that it's not a safe place, is simply not the case. Base camp is much safer than any encampment that we have anywhere in this city or in our county, simply because there are people there who can provide formal structure and organization, line of sight always available to the staff, and a lot of caring people working there. The other advantage of base camp that we can't always offer in some of our other shelter opportunities is that service providers come to base camp every day to connect with people. Our GRACE program, for instance, it's a great place for them to meet people, make sure that their healthcare needs are being taken care of, that they are connected to behavioral health treatment, that they get their medications, and a great place to start talking about their plans for the future, being stable, getting housing. And for us, it has been heart-wrenching to hear a lot of people promulgate and perpetuate information about base camp that we simply have no reason to believe is true, because there's no evidence to that effect. Not to say that there isn't an unfortunate incident from time to time. There is everywhere, including in people who have homes. But that's the first thing I would say, is that before the protest on City Hall lawn, base camp was fully utilized. And since then, it has not. And I think I want to give you one other story about that, just to give you a sense of the challenges. So, for instance, there are small encampments throughout the community, as you know. The one large one that started at Camp 210, we had providers of service who were denied access to their clients. We had self-reports and reports from advocates there that people who were vulnerable were being assaulted and raped. We have 911 responses that were not allowed to go into the camp to, help the person who called 911 for assistance. And we also have case managers who were working with people who were stabilizing at base camp, getting their medications, looking toward a future where they would have a place of their own, a home of their own, who went to Camp 210, had significant challenges in terms of remaining clean and sober because there is significant drug activity that was occurring there. People went off their meds. People were much more compromised and decompensated. And so what we're hearing from the case managers, besides the fact that case managers and public health nurses have been assaulted and have been accosted, we also know that the people that are most vulnerable were doing much better at base camp because of the structure and organization in connection to treatment and social service providers, but they lost all of that support and in fact were drawn into drug use and other activities that really made it difficult for them to connect. So a lot of the case managers working with people there are pretty heartbroken about this. They're very concerned. I think the other thing we're hearing is that there is a plea to government to create additional shelter type situations for people currently at especially the large encampment. From a staff perspective, we would strongly encourage against that we cannot support any shelter that has no structure or that doesn't have rules of conduct that are reinforced. That science tells us that people the most vulnerable get taken advantage in those situations. I think that has been the most difficult thing for us, is not only is there misinformation, but the misinformation of base camp has led a lot of people to be scared to use it, when in fact, that's going to be their safest option and the best place for them to get on their feet, get the services they need, be treated truly with the dignity and respect they deserve. So we have lost a lot of people to these encampments. The government, staff, at least at the county, we are not going to recommend that we provide housing for people who have a history of predating upon others or who are not following the rules purposefully, that it's just not safe. It's too much risk for the county. There was also a question about the Byron Avenue facility that we use for isolation and quarantine, and could we use some of those rooms? We did look into that to a great extent, worked with the city fire marshal to determine how we might be able to create fencing. In order to have a true isolation and quarantine facility, it must be absolutely separate from anything else to include the staffing, the services, and the physical location. We got to a point where we thought we could do that, but we also realized then that if the census goes up at the isolation and quarantine facility, obviously the people who might be sheltered there would have to be sent away with very little notice. And so it just was not a stable facility to offer as shelter. Not to mention the fact that we still need to find a way to staff any shelter that government sets up. If we're going to fund or support a shelter, at least from a staff perspective, we do everything possible to ensure that the staffing and the services provided are adequate to maintain safety and security of the people there. And right now, it has been very difficult to get any more providers than what we have. We did a great job last year with severe weather shelters. This year, 2 reasons we don't have one. One is because there's shelter capacity unused. And secondly, because those who provided severe weather shelter last year were not willing to provide it this year for fear of COVID transmission. We have no concerns about next winter. We're quite certain that the severe weather shelters will pick back up again. So again, that was a Cliff Notes version. I'll entertain questions and see how you want to go forward, Councilmember Hamo.
Sure. Councilmember Huffman.
Thank you, Anne, for that overview and that insight. That was really valuable. So I appreciate you sharing that. My questions are numbers questions, and the screen share is gone. But the hotel vouchers, I was curious about those numbers and what they stood for. Is it one night? Is it a hotel voucher good for a week? That sort of a thing. What did those specific numbers mean? And then also, I'll throw in my second question, because hopefully they're 2 quick ones. The point in time count, I know that it was just completed again for this year. I'd be interested to hear if there are any final numbers there yet. But also, can you give us a little bit more information of the breakdown of that number? I know it was approximately 700 people last year unsheltered in the point in time count. And I'm interested in hearing more what types of unsheltered are comprised of that 700.
Okay, so motel vouchers, that was the number of motels available at any given night. So a pretty significant increase. And we tend to also prioritize families with children for those shelters. We want to make sure that no family is ever living in a car. In terms of the point in time count, I do not have those numbers yet, although I do want to correct you that the 700 were homeless. The definition of homeless is broader than just sheltered and unsheltered. So we had a number of people who were sheltered and safe. And so 700 was the total number that was counted, but not necessarily unsheltered. I don't have the numbers for this year, and I assume we could get some basic numbers probably by the end of the month. But some of what we do when we do count is a lot of gathering of demographic information. So we'd like to give you at least a better overview of who we're counting and what their story is.
Councilmember Stone.
Can I quickly follow up on that?
Oh, I'm sorry. Go ahead.
Yeah, so I'm sorry. Yeah, I misspoke when I said unsheltered with that 700. So I'm assuming there is a portion that is sheltered within that number, though, of the 700, correct? So people who are at base camp, who are at homes now, encampments. So, okay, thank you. Thank you for that clarification.
Yes. I think the other thing, too, for us, when we look at our strategic plan, and the county, of course, has a local plan to end homelessness. It's a very bulky document, but I encourage you to look through it. It has to be updated on a regular basis. One of the things that we know is that people who are in shelters or people who are in tiny homes are considered homeless. They're still homeless. And the county, up until a year or so ago, focused almost exclusively its energy on getting people housed and to end homelessness. And by that, I mean, we had in our available funds to us only $250,000 a year that we could use for shelters, but it also had to be used for facility operations of other programs. So we had very little that we could give to shelters. With COVID, we were able to get some temporary grants. They don't last for long, but at least hopefully through the COVID pandemic emergency piece of it, where we have been able to work much more closely with the city on getting more shelter capacity.
Councilmember Knudsen, then Stone.
Yeah, thank you, Ann, very much. One of the things that's come out of all this, and I've been saying it all along, is in this conversation, we really can't, we get a lot of phone calls and a lot of emails about just creating more no barrier shelters. Well, no barrier shelters don't work. City of Bellingham has a history of that. It goes back to 1989, a couple of years before I ran for council. There was a no barrier shelter down at the old Series building, and it was less than a month in operation because it was just not a good situation for anybody. So I'm glad you're bringing all this forward. We need to get this message out. We have room. Come and work with us and we'll get you some shelter. And I want to thank Dan for putting this on the committee because these numbers need to be out there so everybody can see these. And you've been in the business forever and you know what you're talking about. So I just want to thank you all for bringing this forward at this time. We really need this information.
And I will say that government is not going to be the answer to everything ever. We're bulky. We have significant obligations to our constituents, our taxpayers, and that we are not going to recommend ever to elected officials a program that we find to be high risk to the taxpayers. But that doesn't prohibit private entities from doing some of the things people are asking for.
I'm going to call on Councilmember Stone, then Lillquist, and I'll recognize Director Lautenbach after that. So Councilmember Stone.
Thank you. Yeah, to piggyback on what Councilmember Knudsen said, I've heard, community members reference, for instance, the Aloha Motel and saying, yeah, that was an example of sort of a no barrier type shelter in the community and the problems that persisted in that area. And so one of my concerns is how do we identify, and I guess the question is, has there been the ability to do any sort of intake with respect to the individuals who were at Camp 210 and are now at Jerry Field to know who those individuals are, what their barriers are, and what needs are present?
I will tell you that our outreach people know almost every single one of them, unless there's some newcomers to the community. A number of them have been receiving services, similar to the story I said earlier, where some of them have dropped out of service because they're just too incapacitated right now because of the drug use. Some have been severely traumatized during an assault and again are incredibly in bad, fragile shape. But yes, we know them. We have offered services. Right now, a lot of the helpers are being denied access to those folks. But our hope obviously is that we can reconnect.
So just a brief follow-up on that. I guess you'd made reference to the fact that providers had been denied access. And I just want to know if there was any additional information about by whom or the circumstances as far as, in the state that many individuals are now, were they themselves sort of rejecting that those interactions, or were there other people intervening in that? Or I don't know what you're able to share, but.
Well, I can give you some examples. So because people are intense, when you go up to the area, you don't know where your client is. So there's typically, in a very unstructured fashion, a number of people who take on leadership roles. Sometimes they're advocates and helpers. Sometimes they might be campers. So we had one volunteer say, well, we don't really have one leader, and what that other volunteer told you isn't what I'm willing to do. So there's just a lot of confusion and a lot of people who say, I'm not going to tell you where that person is. And I think part of it is, if you're a helper, you're considered part of the problem. Again, it's just misinformed advocacy. And I think that's the part that is so troubling for our case managers. These people work really hard with people with significant challenges. Their hearts are huge. And to see their clients decompensate and be victimized, sometimes severely traumatized, is pretty heart-wrenching under the guise of living in peace. So I've had some people send me notes about, why don't you just let these people live in peace? They are not living in peace. They are being traumatized. It is a dangerous place. People are being harmed on a regular basis. That's very, it's just so sad to us.
Councilmember Lillquist.
Well, thank you. I've got a comment, an easy question, and a harder question. But first, I actually want to share a bit of information. There's been allegations, as you say, of assaults or even rapes at shelters, at base camp, at Camp 210, whatever. I asked our police to pull all the reports of any serious assaults and crimes, and it's surprisingly low. I mean, there must be a lot of unreported incidents because the police have no record of any rape being reported at Lighthouse Mission. At the drop-in center, they also had no reports of any rapes, although 2 rape reports were taken at the drop-in center. They were from elsewhere. None were, thankfully, at base camp, either at the high school or Cornwall location. And there were no reported rapes at Camp 210, which, I mean, I just heard someone say that they heard about one there. So our police aren't getting these reports. And felony assaults are a little different. There are some cases of felony assaults under investigation, but it's surprisingly low. So a bit of information. Whatever's going on there that is truly criminal, it may not be making it to our police for investigation. Easy question, or the comment first. The Byron Street facility, I've suggested that maybe that be revisited, that a scaled down version that would be compatible with a quarantine facility maybe could be visited. Especially as a severe weather option for families or households who might be eligible for the motel voucher program. In other words, kind of narrowly specify who could go in there and reduce it. I'm hoping that it may be compatible with a quarantine and isolation facility, because I think that does need to come first, but maybe there's room for both. That's more comment, Ann. I don't expect a response from you. Easy question. Family Promise. Is Family Promise still going through this last year through COVID? That was a volunteer program where various churches would take turns sponsoring, hosting, putting up families who were experiencing homelessness. It was a shelter kind of solution that was more individualized, more private. Is that still going?
That's an easy question, and I don't know the answer. And what's so sad is I think somebody told me the answer once, but
Okay.
I don't recall it.
I have an answer. I have a quick answer. Family Promise is still going, but it's going in a different form. And so they are not moving families around from church to church anymore and dealing with the volunteerism. So it's a different scale. I just actually talked with their new executive director the other day. I think they have a total of 12 units spread through our community. And so they're housing people in more traditional form.
And so my guess is Family Promise is not included in Ms. Deacon's chart because that's an entirely private effort. So here's the more complicated thing. So I'll accept that more people can utilize base camp and the overflow facility than are using it. We have some unused capacity, and there's probably people who really would be better off if they would head down to those shelters, especially next week if the weather turns cold. Even so, I'm willing to accept the idea that we may not be serving everyone well, that our specialty shelters may be mostly full, not that much room for more people, and the drop-in center may not be suitable for everyone. Ms. Deacon, would you be able to, how willing would you be to offer an opinion on what kinds of people aren't currently well served in terms of character, not just quantity? We've had a lot of talk about families with children needing special attention, that even motel vouchers are an unsettling situation for children. So even those vouchers aren't great for that population. Do you feel that there are some populations who aren't being well met, even if they're open beds right now?
I think you put your finger on it. So I think families with children is clearly a priority for us, and a priority in a number of different arenas, not just in the homeless system. We served 220 families with children thereabouts last year who were homeless and got them into housing. But I think that is probably the most glaring example. There are some people, especially individuals, who have a history of things like predatory behavior, violent behavior. And at least from a government point of view, we certainly don't offer housing especially for them, although if they have a history of it, we have housed people who have had very serious histories of violent predatory behavior who, with the right housing, have actually done really well, became kind of a star in their neighborhood and moved on to independent housing as they've got full employment. But that takes very, very special care and treatment, if you can imagine. So there are some people I think that the government probably will never be able to serve. But again, like I said, that doesn't prohibit, private entities from stepping up. But even with Housing First or even with Base Camp, everyone is welcome until they do something that makes them unwelcome. And even then, at least with Base Camp, they allow people to come back after meeting certain requirements. Same with housing. We've had people really destroy their opportunity for housing, lose their housing, and yet we still rehouse them when they have met certain points of progress and get them rehoused again. So there's very few people that we wouldn't serve, but there are a few out there that are just not something the government has anything to offer.
Any follow-up, Councilmember Lillquist?
Well, I did want to, when I was down last Thursday, I guess it was, wow, that was kind of recently. I was speaking to some folks. I handed out some cash to a couple of people to help them because they had trailers or container loads of personal belongings, more than you bring with you going into a shelter. These people were kind of living off, they had a household that they had to move around. And it seems to me that those people who have achieved a kind of independence, even though it's a camping independence, they're not great candidates to come into a drop-in center. I don't know what you do about that. I mean, I think a tiny home is probably the next plausible place for such folks. They can bring their tent and gear and cooking equipment, which they have, into a tiny home, unlike maybe into a shelter. I don't know, I'm thinking about populations, and I heard about another population that might be people who are employed. I mean, it's a sad case that there are people who are employed, but with not enough income to have an apartment of their own. And they have jobs, and they have jobs that might require them to work in the evening. And they're not going to meet the check-in time for a shelter. So I'm thinking there are some special needs populations that are worthy of our assistance, as worthy as anyone. And I don't know if we're catching them. And as you say, Ms. Deacon, maybe we don't have to catch them. Maybe there's somebody else who can help catch them too.
I think for us too, I just want to say that this is always a balance, right? So the solution to homelessness is housing. And if we overinvest in shelters, which perpetuates homelessness, then we're not addressing the solution. And so for us, in our work with you, the city as well, we work really hard on ensuring a balance and that we truly are investing the resources we have adequately in the solution to homelessness.
Before I recognize Director Lautenbach, I just want to chime in here as the committee chair. So, and it's exactly what you just said, Ann Deacon. Housing is the solution to homelessness. And I would add to that, for some folks, wraparound services are also going to be part of the mix. So funding housing development and then some service provision, it will help with this. However, we are a city, we're not a country. We cannot print our own money. We can't go into debt. We have to balance out every year. That is the reality. It's not a should. We don't live in a should. We live in an is and is not. It's unfortunate, but that's the way it is. So, and I'll stop pontificating and ask a question here of substance. House Bill 1590 passed. I went and lobbied for that before COVID, which seems like a lifetime ago down in Olympia. That bill has passed. And my question, I think, might be for Tara Sundin. The House Bill 1590 is for mental health. It can raise, it's 0.1% sales tax. It can raise countywide about $5 million in pre-COVID dollars and about 2.8, maybe a little bit more, a little bit less if it were just citywide, if it were just in Bellingham. 60% of that money is required by the bill to go towards housing. That can be housing development, it can be rental assistance. If it's housing, and it's housing capital, which I mean building apartment buildings, using the Bellingham Home Fund as a model, we were able to leverage 12-to-1 on capital investments. That's why we have all these apartment buildings that were created by the Bellingham Home Fund. So I think that if House Bill 1590 were enacted in what either vote of the people, councilmanically, city or county level, there would be new dollars for funding housing and services. So my question, Chair Sundin, is if the city chooses to exercise its authority on House Bill 1590, does it preclude the county from exercising their portion of the authority?
No, I don't believe so. So we could go first and then they could do it and they would get the, the balance that's collected outside of the city of Bellingham.
Okay. And then just very quickly, I know we're kind of running out of time here. In your expert opinion, would that affect the number of units that could be produced, or would it affect in a negative way if the city exercised this option and then the county did theirs as well? Because it would be a smaller amount of money, presumably, that the county would have access to. So would that be a problem?
Well, it would be still the same amount total for the entire county. It would just be allocated directly to the city for city projects, to the county for unincorporated and small cities.
Okay. What I'm getting at is that I believe that we have inequity in Whatcom County when it comes to housing. Bellingham voters decided to pass the home fund twice. There is no Whatcom County home fund. I think maybe Ferndale or some other small cities have looked at it, but the amount of revenue that they could produce would be fairly small. So what I'm trying to get at is that I don't believe that kids and families from Kendall shouldn't have opportunities at housing. I think they should have housing opportunities. And so I'm urging us to all think about how we can and help enact a countywide, what would be the equivalent of kind of like a housing levy, but it would also serve folks with mental health illness, behavioral health or issues. So I would just encourage us to think about that, because Ms. Deacon was absolutely correct. It comes down to housing. My understanding is right now we have about a 3% vacancy rate. That's the low end of a healthy market. A few years ago, it was less than 0.5%. So we're going in the right direction structurally on that, but we're not there yet, and we need to have those additional dollars to help us achieve these goals. And with that, I'm going to ask one more round for questions from committee or council members. Anything? Councilmember Anderson.
Thank you. I just wanted to point out a comment that was shared from staff and chat that Base Camp does serve working groups with off hours, that they sleep in a separate area so that they're not disturbing the other individuals. So if you have a late working job, it doesn't preclude that you're not going to be able to use Base Camp as shelter. So just so that the public is aware of that little announcement. The other thing is, if we did look at House Bill 1590, we're depending on, even though we advocate to the county council to enact that taxation, but if they don't, it would be great for us to consider it. I also agree with Councilmember Hamel that we're all part of a community. Sometimes I hear about, like, why are we supporting Bellingham homeless? And I keep saying it's not Bellingham homeless. It is a county. We are part of Whatcom County. And we thankfully have had wonderful voters who support our community by the Home Fund. But if we were able to enact it on city council's side, we could also hopefully put in a clause in there that should the county enact it, then hopefully we could then consolidate so that we're not taking a disproportionate fair share of the funding, given that we probably generate more taxation because of where a lot of services and businesses are located. And much like the partnership that we did with our COVID dollars, putting everything together and really kind of working with the county to distribute across the board where the need was the highest. And I totally agree that, our smaller communities, if there's any way that we can use some of the sales tax, the generated in Bellingham to be able to provide housing options in some of our smaller rural communities, I would be completely supportive of that because it should be housing across the county that we're supporting. So thank you for bringing that up. And thanks for recognition.
Councilmember Stone, I see that you have your hand raised, and I want to acknowledge that I was mistaken in my earlier comments to you about the authority on 1590. My understanding was that if a city does exercise its authority, it precludes the county. So I apologize, I was mistaken. I'm glad that we got that cleared up here today in public. And go ahead with the question.
Great, thanks so much, Councilmember Hamel. Ms. Deacon, I guess the other question I have, and I don't know if you're prepared to respond to it now, but looking at the weather forecast and drop in temperatures and potential snow coming, I know that the question is, there are members of the community that we're saying government might not be the entity, to serve them in a shelter or in, sort of long-term facility because of violence or other issues. But with respect to emergency, severe weather, shelter, I just have to ask candidly if there's anything online, for the impending weather.
We had 88 vacant slots last night. I think we have enough to serve people who want to be served. And it is possible that there may be some people whose immediate behavior will not allow them into a congregate setting.
And so I guess
which does not prohibit, again, a private entity from stepping in.
Yeah, and I guess just to end on that is the sense of urgency that I guess I feel with respect to the camp at Jerry Field to figure out a way to do an intake and reconnect with those individuals so that we can eliminate any misinformation and really have that that direct communication to assess needs and move forward as a community. So thank you.
And I'm concerned that advocates may be misinformed, and I'm more concerned with getting them educated as opposed to the campers who actually know the resources.
Okay, with that, I'm going to go ahead and thank you, Director Lautenbach, for bearing with us here. Go ahead.
No, this is a great discussion. I don't have anything to add. Anne is, such a great, knowledgeable resource. And I just want to recognize Anne and the team. We have 3 staff that are, well, Anne is one of them, but we have 2 staff that are full-time working on homelessness issues for the whole county. And they're just a really great, dedicated team. Anne, I hope it's okay that I say this, but Anne has been doing this work for 40 years. And it is her life work. It is her passion, and really appreciate the work that they're doing. It's really hard to balance the long-term solutions with what feels very urgent now. And they've really kind of struck that balance, and really also trying to think about serving the continuum of, the low acuity who may just need first and last month's rent to get stabilized again, to folks who have been homeless and have really severe mental illness or substance use disorder and have been chronically homeless. So there's a wide range, and I really appreciate the team and their work to try to balance all of these competing priorities, especially as the health department is busy this year and has been, and we're trying to pay mind to this work as well. And appreciate you bringing us here to share more information and debunk some of the myths that we're hearing.
Thank you, Director Lautenbach. Councilmember Stone.
Yeah, Director Lautenbach, I definitely want to echo the appreciation for Anne and her team and all of the work that they're doing now and have been doing for a very long time. It's very appreciated. And I also just wanted to follow up with a question for you regarding, in particular, the current site at Jerry Field and rumors about possible positive COVID tests and in that population, and whether you're able to speak to whether we're able to confirm that information, whether there's been able to be any testing on site and any outreach to move people to Byron Street.
Sure. At this point, those rumors are just in fact what they are. They're rumors. We don't have any information to confirm that. We do, and we did at Camp 210, once we have a case per our usual sort of outbreak guidance, we test twice weekly until we've gone 2 weeks without a single case. So until we have a positive case at any of these sites, we wouldn't as a routine be doing testing. However, Base Camp does have the ability to rapid test individuals at intake.
Okay. Thank you, Director Lautenbach. Thank you, Ann Deacon, for all of your work. I echo Director Lautenbach's remarks about your dedication to all of these pieces. And I just really appreciate you and your team. So thank you. And with that, it's 2 p.m. and end of